Calling the Joint Committee on Human Services and Health, 3 o'clock calendar. This meeting will present for Human Services. We have Senator Lucha and myself, and for Health, we have Senator Baker. This meeting will include the following calendar, which is a 3 p.m. joint agenda for Human Services and Health, and the 3:45 HMS Human Services agenda. This meeting is being streamed live on YouTube. In the unlikely event that we have to abruptly end this hearing due to technical difficulties, the committee will reconvene to discuss any outstanding business at 3:10 p.m. February 15th, 2022, in conference room 225 and via video conference, and a public notice will be posted on the legislature's website. Your audio will be muted and video disabled until shortly before it is your turn to testify. Each testifier will only have 1 minute. If there's a technical glitch during your time to testify, we may have to move on to the next person due to time constraints. We appreciate your understanding, and we remind you that the committee has your written testimony. I apologize to those who are waiting, but please, if you can stand on your written testimony, because we do have a long list of testifiers, we appreciate it, and we have read your testimony. I'll be reading a list of individuals who submit written testimony for each measure. We apologize if the closed captioning does not accurately transcribe the names. If you're interested in reviewing the written testimony, please go to the legislature's website. You will find a link on the status page for the measure. First up, SB 2424 relating to marriage of minors requires that in the event that one of the respective parties to a marriage contract is a minor and the other party is more than 5 years older than the minor, the Child Protective Services Unit of the Department of Human Services shall investigate and report to the family court in which the minor resides before the marriage is approved. First up, testifying for Hawaii Status Commission on Women in support, Kara Chabola Karos. Are you there? Kara, is that you? Move on. Okay, we're going to move on. Department of Human Services, State of Hawaii, providing comments. Department of Human Services. Okay, we're going to keep moving on because we have a long list. Next up, we have Michael Galoya, Stonewall Caucus for the Department of Democratic Party of Hawaii in support. Michael Galoya.
Good afternoon. Senators, this is Michael Galoya, chair of the of the Stonewall Caucus of the Democratic Party of Hawaii. We stand in support of this measure. Mahalo for the opportunity.
Okay, thank you very much. Okay, next up we have Zonta Club Tanya Ozone and support. Tanya.
Mahalo, thank you for the opportunity, Senator. We support a ban on child marriage in Hawaii without exemption because they rarely are worth the risk that they entail. However, if the legislator wants to take this more moderate approach with family courts and the Department of Human Services involved in this process, we would recommend adopting the law and require this in-depth study to analyze these issues facing minors who marry. We would lend our support to this in-depth review. Additionally, deleting marriages of 15-year-olds is recommended now. Our stance is in accord with the State Department, which describes marriage before 18 as a human rights abuse and contributes to economic hardships for people who enter this marriage. In America and in Hawaii, 16-year-olds can't vote, they can't fight in combat, they can't obtain a credit card. You must be 18 to buy cigarettes and 21 years old to drink. It makes sense not to allow these individuals to wed. Thank you.
Okay, thank you very much. Okay, next up we have testifying for Unchained at Last in opposition. Okay, seeing that. Please proceed. You have 1 minute.
I'm Director of Policy and Advocacy at Unchained at Last. We're a survivor-led nonprofit working to enforce child marriage. We are experts on this issue. I urge you to vote no. These loopholes that allow parents to enter children into marriage, either with a signature of 15-year-olds with judicial approval, are dangerous for several reasons. The first, we know that when children are forced to marry, the perpetrators are typically the parents. Children who are forced to marry are forced to lie. These laws incentivize and undermine our statutory rape laws. And I have written testimony that goes into more detail. I ask you to review. SB 2424 does nothing to close these loopholes. It keeps them in place, just adds an investigation by CPS when the minor is marrying someone 5 years older, which is problematic. It does not mitigate the risk, the high risk of forced marriage for a child who can easily be forced to marry because they have limited legal rights. It does nothing to mitigate the devastating lifelong consequences. As you heard, the State Department refers to marriage before 18 as a human rights abuse. It destroys
Okay,
girls'
so
lives.
Ms. Hanish, thank you very much. Okay, next up, okay, we don't have anyone else registered to testify. Is there anyone online who wishes to testify on SB 2424 IC, Department of Human Services? Are
Aloha,
you,
aloha, Chair. Yeah, thank you for the opportunity to testify. The Department of Human Services did submit written testimony. We appreciate the intent. We offered comment, proposed and amendments, as well as requested clarification. The department also respectfully defers to the judiciary, and I'll be available for any questions. Mahalo.
okay, thank you very much. Okay, no one else having to register to testify. Those who have provided written comments are Hawai'i Youth Services Network in support, Tahiri Justice Center in opposition, Eileen McKee in support, Don Tyree in opposition. Members, any questions of those who have provided live testimony? Okay, seeing none, we're moving on. SB 2880, relating to home health care, prohibits any increase in the fees charged for providing home health care services during the pendency of an emergency proclamation or state of emergency concerning a public health pandemic on the sole basis that the patient receiving the services requires that the home health care service provider be vaccinated against the underlying disease causing the emergency. Okay, providing comments is Hawaii Association of Hawaii. Okay, thank you very much. So we're gonna, and there's no one to ask questions of, so I'm moving on. SB 2883, relating to medical facilities, creates a task force focused on the hiring and training of culturally accepted interpreters to assist non-English speaking populations seeking care at Hawaii Health Systems Corporation facilities. First up, we have Office of Language Access providing comments.
Good afternoon, Chair Sabunavantula, Vice Chair Mr. Lucia, and Vice Chair Baker. The Office of Language Access stand on our written testimony, offering comment, and will be available for any questions committee may have. Thank you, Chair.
Thank you very much. Okay, we don't have any others who have registered for SB 2883. We have written support from Hawaii County Council Miley David and Don Manago for Hawaii County in support. Questions, members, for anybody? Anybody online who wishes to 2883? Oh, I see. Okay, so I see Liza Gill. We've moved on though. We're in 2883. So Liza Gill, please proceed.
Oh, aloha. Thank you, Chair. Liza Ryan Gill with Hawaii Coalition for Immigrant Rights. We submitted testimony in support. Also, just want to call out some of my colleagues who are also here, who also submitted testimony in support, and I think their voices are more important than mine. So mahalo.
Okay, thank you very much. Is David Anitok wishing to testify on SB 2883?
Madam Chair, hello, greetings and Yakwe. This is David Anitok. Yes, thank you very much for the opportunity to offer testimony in support of Senate Bill 2883. This is a continuation of last session's bill that we brought forward to the same committees, and we are honored to continue this effort working together with the task force to create ways forward to achieve the same common goal that I believe each of the stakeholders listed in the bill itself is willing to work together on. So I thank you again also, Madam Chair, and special recognition to Senator Kanua for carrying this forward again, as this is a dire need in especially rural areas, such as Ocean View, where it's got a vast growing communities from Marshall Islands and the other Kofa Micronesian communities. And so we thank you again for the opportunity. I know we have limited time now, but be happy to answer any questions any of the committee members may have. Mahalo.
Okay, thank you very much. Okay, anybody else wishing to testify on SB 2883? Okay, Neil Palafox, please proceed.
Thank you, Senator, very much. The views that I present are my own views because I mentioned that because I work for the University of Hawaii Medical School. One of the things I just wanted to bring out is that in the COVID-19 pandemic, the Pacific Islanders held 26% of the state's COVID infections. But when the state actively intervened and produced linguistic access, they produced more contact trainers from the community, and they include the community, it is now 7%, a 73% improvement. And this to me is an example of what SB 2883 does. It takes this real-time evidence and uses a task force to maneuver it into the best practices for the state of Hawaii. It is an essential bill. The task force is essential, and I certainly support it. And I have written testimony, and you have that testimony. If there's any questions you have, I am available online or offline. Thank you.
Thank you very much. And I see I missed a whole list of people. Hawaii Friends of Civil Rights, Patricia McNamara in support. Is Patricia on? Okay, moving on. I see Linda Rosen for Hawaii Health Systems Corporation providing comments. Linda, are you able to get on, Linda? It's your turn. You want to provide comments on SB 2883? You need to unmute yourself. Thank you very much. And I see I missed a whole list of people. Hawaii Friends of Civil Rights, Patricia McNamara. Is Patricia on? Okay, excuse me. I guess Patricia McNamara, are you able to turn on your video? Are you able to get on, Linda?
I am here, Chair.
It's your turn. You want to comments? Okay, wait a second. Apparently, I called Patricia McNamara first, and she did not respond. I'm sorry. McNamara first of Hawaii Friends of Civil Rights. So Linda, could you please wait and let's finish hearing from Hawaii Friends of Civil Rights.
Of course.
Okay, so Hawaii Friends of Civil Rights, please continue. I apologize for what happened. We need to unmute her. IT can, yeah, thank you.
Good afternoon, chairs. The Hawaii Friends of Civil Rights stands in support of this measure, the intent of the measure. We certainly need to improve language access across all of the state's institutions. Thank you very much.
Okay, thank you very much. And I apologize for the tech problems. So Linda Rosen, your turn. Hawaii Health Systems Corporation providing comments.
Good afternoon, chairs and committee members. I will try to be very brief. We do commend the legislature for its interest in addressing the adverse health outcomes associated with the difficulties that folks with limited English proficiency have. And we would really like to also suggest, though, that HHSC has limited resources in terms of understanding of these issues, creating preventive materials. And we do have, of course, interpreters, but this is always done remotely in hospitals across the state. And there are two major reasons for that, and that is that medical interpretation is a very specialized field, takes a lot of training, and the ability to maintain on-site interpreters in all the various languages is very, very difficult because we do not have any revenue that's not reimbursed by insurance. And even if we had a revenue stream, it'd be very difficult to maintain those with this level of proficiency available in facilities. So thank you very much. And we'd like us to continue with the task force. We would appreciate if some resources could be provided. Thank you.
Yes, I understand, Linda. Thank you very much. Okay, next. No one else having registered to testify for SB 2883. Are there anybody on Zoom who wishes to testify on SB 2883? Okay, those who are providing written comments or support are W. Alick for Marshallese COVID-19 Task Force and support, Della Nakamoto, Marshallese COVID-19 Task Force and Voices of Micronesians of Maui in support, Catherine Chen, Hawaii Coalition for Immigrant Rights in support. Amanda Fernandez, Hawaii Public Health Institute in support. Lloyd Henion in support. Gerard Silva in opposition. Members, any questions of the witnesses we have? Okay, thank you very much. Seeing none, we're going to move on. SB 2737. Relating to behavioral health long-term care, authorizes the issuance of general obligation bonds to develop a long-term care facility at Goonsburg building on the Hawaii State Hospital campus. First up, we have Hawaii State Department of Health in support.
Yes, good afternoon, Chair and Vice Chair and committee members. This is Amy Curtis with the Adult Mental Health Division from the Department of Health, and we stand on our testimony in support of this measure. Let me know if you have any questions. I'd be happy to answer them.
Okay, thank you very much. We have Louis Urchik in support. I saw Louis on. Did you want to testify? You did not register. Okay, we're going to move on because he didn't register to testify for this measure. We have no other persons registered to testify on SB 2737. Anybody wishing to testify on SB 2737? We have written testimony in support from Hawaii Disability Rights Center, Louis Urchik, Hawaii Substance Abuse Coalition, Alan Johnson in support, Maria Grams, Partners in Care in support, Alex Lichten, Hawaii Psychological Association in support. Members, any questions? Oh, I see Louis Urchik. Do you want, Louis, did you want to testify on SB 2737? You did not register to testify, but you provide written comments.
No, I'm on 2647, Senator.
Okay, so we're going to move on. Members, any questions on SB 2737? Okay, we're moving on. So next we have SB 2634, relating to health, appropriates money to extend Medicaid postpartum coverage to 12 months following the end of pregnancy. This is the Women's Legislative Caucus, part of the Women's Legislative Caucus package. So on SB 2634, we have Judy Moore Peterson in support, Department of Human Services, State of Hawaii. Please proceed.
Thank you very much. Thank you for this opportunity to testify this afternoon. I'm Judy Moore Peterson. I'm the MedQuest Administrator for the Department of Human Services. We definitely support the intent of this measure, and we do offer comments. We respectfully request support for this budget priority within the executive budget. Thank you very much, and I'm available for any questions.
Okay, thank you very much. We also have Aloha Care Peggy Miriswa in support.
Aloha, thank you so much, Peggy Miriswa with Aloha Care. We stand in strong support of this measure and just want to point out that covering women for 12 months postpartum really helps to cover the gaps in care that women can go through, addresses their physical and behavioral health needs, and is really what makes a strong safety net in our communities. So thank you so much for listening, hearing the bill, and I'll be here if you have any questions.
Okay, so for we have Amanda Fernandez, Hawaii Public Health Institute in support. Okay, she's not here, so we're going to move on. Save Medicaid Hawaii, Doris Siegel Matsunaga in support.
Yes, Aloha chairs and members of the committee. Save Medicaid Hawaii is in strong support of this bill. We'll stand on our testimony and just wanted to add, however, that that as Ms. Moore Peterson said, adequate resources will be needed in order to make this real. Thank you very much.
Okay, thank you very much. So we also have Rennie Soon, ACOG, in support. I see her here. Dr. Soon.
Aloha chairs, vice chairs, and other committee members. My name is Rennie Soon. I'm the chair of Hawaii section of ACOG, and we'd like to thank you for taking the time to hear this important measure that we strongly support. You have our written testimony, but I just wanted to highlight a couple of things. That 1 in 3 births in Hawaii is covered under Medicaid, and losing health insurance means losing access to health care. And for many of the patients that we take care of, The chronic health conditions that were exacerbated by the demands of pregnancy just do not go away at 60 days. Our own maternal mortality committee found that over half of the maternal deaths in Hawaii are occurring in the late postpartum period after 6 weeks. So 60 days is simply not enough. And as the leading healthcare professionals in the care of pregnant and postpartum people, we urge you to pass this measure. So mahalo for this opportunity to testify, and we'll be available for any questions.
Okay, thank you very much. Next up, we have Healthcare Association of Hawaii and Support. I see Paige Choi.
Yeah, thank you, Chair. We'll stand on our testimony and support. It's really great to come after Dr. Soon. I know we've worked quite a bit with her and her colleagues. All the hospitals have gotten together and have made addressing disparities in maternal health a priority. And we are very excited about this step and this bill. And thank you for hearing it, and thank you for your time.
Okay, thank you very much. Next up, we have Don Weisman, American Heart Association and Support.
Yes, thank you, Chair Buenaventura, Vice Chair Baker, and Vice Chair Ihara, and members of the committee. American Heart Association stands in strong support of this measure. Just want to point out that there's a growing body of evidence showing that some of the most dangerous pregnancy-related complications, including preeclampsia, blood clots, and heart problems such as cardiomyopathy, may not surface until weeks or months after delivery, and these issues are rising in prevalence. We've already addressed the disparities that exist in our state. So I'll just say that healthy mothers are the foundation of healthy families, and implementing systems that support mothers and ensure equitable health outcomes should be a policy priority for Hawaii legislators. Mahalo.
Okay, thank you very much. We also have Penelope McKenzie in support. Is Penelope present? Okay, we're moving on. Theresa Meyers in support.
I'm Theresa Meyers. I'm also a practicing obstetrician and gynecologist in Hawaii. As a resident physician, I spend a lot of time taking care of high-risk women, especially at Kapiolani. And one thing I wanted to draw the committee's attention to was here in Hawaii, with our unique geography, we have a lot of women flown from neighbor islands to Honolulu, specifically for high-risk maternity care. When they deliver early, their infants stay here, and they're often not able to return to their home and their primary care providers prior to 60 days postpartum, and therefore there's a huge gap in coverage for those patients. Thank you for hearing this bill.
Dr. Myers. Okay, thank you. I'm sorry, I cut you off. Divya Dethier in support. I see Divya here.
Hi, good afternoon, Chair and Vice Chair and members of the committee. Thank you so much for this opportunity to testify in strong support of this bill. I'm also a practicing OBGYN. You have my written testimony, but I wanted to share the story of one of my patients who was pregnant with her fourth child and admitted to the hospital with severe kidney infections for the majority of her pregnancy. She very much wanted birth control afterwards, but due to the 60-day limit, she was not able to get that in time and came back to the hospital just months later with a new twin pregnancy and spent most of her subsequent pregnancy hospitalized again with severe infections. This new pregnancy and the morbidity were preventable had her insurance coverage lasted longer. We can and must do better, and I strongly urge you to pass this bill to help us better serve the mothers of Hawaii. Thank you so much.
Okay, thank you very much, Dr. Dethier. Okay, no one else having registered to testify on SB 2634. Anyone online who wishes to testify on SB 2634? We have a lot of written testimony. Okay, so we have written testimony in support. Executive Office of Early Learning, Hawaii Status Commission on Status of Women in Support, Budget and Finance providing comments, Hawaii Association of Health Plans in support, Hawaii Primary Care Association in support, Hawaii Women's Coalition in support, HMS-HTH in support, Kokua Kalihi Valley Comprehensive Family Services in support, American Academy of Pediatrics in support, Planned Parenthood Alliance in support, Hawaii Children's Action Network in support, Hawaii Women's Learn support, Early Childhood Action Strategy in support, another HMS-HTH in support, HMAA in support, Hawaii Association of School Psychologists in support, Family Forum support, Public Health Association support, Hawaii Pacific Health support, Mental Health America of Hawaii in support, Hawaii Maternal and Infant Health Collaborative in support, Kaiser in support. And we have Association for Infant Mental Health in Hawaii in support, Ahahui Ona Kauka in support, Healthy Mothers, Healthy Babies Coalition of Hawaii in support, and we have 25 other individuals in support. Members, any questions on SB 2634? Okay, seeing none, we're moving on. You're just in time, Health Chair, for the Health Committee hearings. Please proceed. We are looking at SB 2432, your lead.
Okay. SB 2432. Okay.
Yes, relating to health.
All right, relating to health, this clearly defines the group of professionals who are prohibited from knowingly referring or transferring patients to an uncertified or unlicensed care facility, repeals the landlord exclusion, requires the Department of Health to prioritize complaint allegations based on severity of inspections for state licensed or state certified care facilities. First, we have Department of Health.
Good afternoon, chairs and vice chairs, members of the committee. Keith Ridley on behalf of the Director of Health. We stand in support of this bill with amendments. Thank you very much.
Thank you. Executive Office on Aging.
Good afternoon, Chair Keoho Kalole. This is Caroline Kadirao, Executive Office on Aging. We stand in strong support of this measure. Mahalo.
Thank you. Department of Human Services.
Aloha chairs, vice chairs, members of the committees. The department stands by its written testimony, providing comments. I'm available for questions. Mahalo.
Thank you. We also have testifying in written testimony in opposition from the Hawaii Substance Abuse Coalition and supporting testimony from Jomel Daldalao. Is there anyone else on the call who'd like to testify? Okay, members, questions? All right, seeing none, we'll move to the next measure on the agenda, SB 2200. Relating to tuberculosis screening. This requires the Department of Health to amend its administrative rules regarding tuberculosis screening requirements for direct support workers in the department's Developmental Disabilities Division. First up, Department of Health.
Aloha, Chair Kahakalole and Chair Buenaventura and esteemed committee members. I'm Dr. Glenn Wasserman. I'm Chief of the Communicable Disease and Public Health Nursing Division, representing the Director of Health. And the Director of Health, the Department of Health stands on its written testimony in opposition to SB 2200.
Thank you very much. Next, we have James Kilgore in support.
Aloha, chairs, vice chairs, and committee members. My name is James Kilgore. Thank you for the opportunity to testify on this matter. Full Life's a nonprofit that serves people with developmental disabilities to live a full and self-determined life on Hawaii Island. And I stand by my written testimony supporting SB 2200. I have a few quick additional comments. We have an excellent relationship with the Department of Health, and they've been extremely supportive. But the current TB rule designating direct support workers and their supervisors as facility-based healthcare workers or licensed care home workers is inaccurate. And it creates barriers to hiring direct support workers and barriers for participants accessing services in a timely manner. There is a group of direct support workers that are currently exempt from these regulations. They work in the same waiver program with the same participants. The only difference is they're hired directly by the participant rather than the agency, such as Full Life. And thank you again for the opportunity to testify. I'm available to answer any questions you may have.
Thank you very much. We also have written testimony submitted by the State Council on Developmental Disabilities for comments and late testimony from Vicki Linter in support. Members, any questions?
I have a question, Chair. So for the Department of Health. Can you speak up?
Yes, please.
Okay, so I wanted to just check in with you because you said you're opposed to this. I'm sorry, I don't see any testimony here. So could you articulate why you're opposed to this, and are there any amendments that can be offered? Because I think the intent is good.
Well, the symptom screen is a very basic form of TB evaluation, and it's usually reserved for non-healthcare workers, those who don't have risk factors for those who already have a positive TB skin test. And we've had numerous individuals that we've screened who had no symptoms, but actually clearly had TB disease, as evidenced by the TB clearance process, which included a chest X-ray and confirmatory sputum cultures. We've even had direct care workers in developmental disability, at least one who had active tuberculosis. So we don't think that the symptom screening is sufficient. And in the bill, it cites that the request is to use the same standards as people who are, excuse me.
Can you live with a
Child
change?
care workers, foster care workers, and school personnel. And in fact, those people do require a TB clearance as well and have to go through the process.
Okay, thank you, Chair.
So I have a question.
Yes,
So
Senator.
so thank you. So for Department of Health, I guess you're saying that the developmentally disabled social workers claim that the type of clearance level for child care workers are not as often as they are. So what is wrong with keeping them the same? Because we are having a difficult time finding developmentally disabled social workers, as testified to by Full Life and other people.
Yes. So I think this has been a more recent problem during the pandemic. Normally our public health nurses, provide support and services, and particularly in the neighbor islands like the Big Island. In the past 2+ years, they've been actively engaged with the pandemic as sort of a priority. So that they've had to make TB or special arrangements for TB appointments for clearances. And in some cases, they weren't able to see patients early on in the pandemic. The individuals who need the clearances can actually go either to the public health nurses, they can go to their private physician, or even, another physician to get a TB clearance done. I think that that this problem will kind of go away as things become more normalized after the pandemic. I don't perceive that it was a problem before the pandemic.
Okay, so here's my question. Why is it that there is more screening done for those who are helping the developmentally disabled than those who are providing childcare? I want to know why there's a disparity.
Okay, well, that's a different question than what's in the bill itself, which requests for a symptom screen. So there is one disparity, which is the requirement for a TB skin test compared to some of the other groups. But again, we've seen cases within the developmental disabilities and feel that, based on CDC recommendations and our epidemiology, that this is warranted.
Okay.
But a clearance is definitely required and not a symptom screen.
Okay, thank you very much.
Members, any other questions?
No.
Okay, seeing none, we'll move to the last item on the agenda, SB 2647, relating to, oh, I'm sorry. Second to the last.
Two more.
Relating to fetal alcohol spectrum disorders, establishes a temporary fetal alcohol spectrum disorders task force within the Department of Health for administrative purposes and requires a report. First up, Department of Health.
Good afternoon. My name is Matthew Shim. I'm Chief of the Family Health Services Division. The department stands on its testimony, providing comments, and I'm here to answer any questions. Thank you.
Thank you very much. DHS in support.
Hi, good afternoon. Judy Moore Peterson. Thank you, members of the committee, chairs and members of the committee for this opportunity. Judy Moore Peterson, MedQuest Administrator on behalf of the Department of Human Services. We appreciate the intent of the measure and we offer comments. We defer to the Department of Health and we ask that any current appropriation into the special fund not replace or reduce budget priorities identified in the executive budget. Thank you. I'm available for any questions. Thank you.
Thank you very much. White Disability Rights Center.
Yes, thank you, Senator. This has been a tough issue for several years that we've been working on, and it's been a high priority. I mean, people that have fetal alcohol spectrum disorder really fall into a gap group. The developmental disabilities requirements are so restricted, they frequently don't qualify for that. They don't qualify for mental health services, and yet they have real needs. And so we've been trying for years to get something going on this. Judy's been pretty good. We had some informal discussions a couple of years ago, but nothing came of it. So I think the task force would really be a good way of formalizing some structure. Let's bring people together. Let's figure out a plan. And what they really need is services. I mean, all the education about not drinking while you're pregnant is great, but that doesn't really do that much good when the kid is then born and needs services. So speaking of that, the other item in my testimony, if the committee wants to think ahead somewhat creatively, you do have this special fund that's created, and at some point you're going to need money for services. I realize that the alcohol tax is kind of a tough political issue, but in the event at some point the legislature decides to increase the tax on alcohol, some of those proceeds could theoretically then be siphoned off into the FASD special fund. If you think about it, when you look at whether there's a nexus for special funds, which is usually the issue, as far as alcohol consumption and then FASD, you don't really get a much better nexus than that. So we think that that might be something to think about in the future. So, but in the meantime, we certainly support the task force. Thank you.
Thank you very much. Next, the Hawaii FASD Action Group in support.
I'll be speaking for the Hawaii Fetal Alcohol Spectrum Disorders Group, Action Group. It was formed as a nonprofit about 2 years ago, but we have been in existence since at least 2014, trying to educate the public about this. We feel this bill is essential and that because of the federal monies that might be appropriated, we do need a plan for Hawaii to be able to receive and accept these funds. A plan and acting proactively is our stand for now. Thank you very much for allowing us to testify. And I believe we have submitted quite a number of members of our action group that are support of this plan as well. Thank you.
Thank you very much. Darylyn Scovell.
Good afternoon, chairs of the committee, all the members of the committee. Thank you for allowing me to testify. I've been actively pursuing this volunteer advocacy with FASD. 1 in 20 children in our school system have FASD. They are the invisible disability. We currently have the FASD Respect Act at the Capitol Hill that is being supported strongly. And if that passes, Hawaii should have something that is already structured to receive those funding. And I think this task force is critical for us to have and to recognize this marginalized and unrecognized disability that we have. Like I said, it's only doesn't affect the children who have the disability. Also, it affects the children who doesn't have disability, who have to be present in their presence in the school system. Thank you so much.
Thank you very much. Sina Pili.
Aloha, Chair, Vice Chair, and members of the committee. Thank you so much for the opportunity I have to testify in support of SB 2647. My name is Sina Pili, and I have been blessed to be a mother through adoption to a child that has fetal alcohol spectrum disorder. I understand and I know through experiences how hard it is to raise a child without the appropriate services because there's a lack of knowledge in the providers that provide services. We have battled most of my son's life being misdiagnosed and then placed into a school system that had no one that was trained about FASD. Everything that was part of his disability was used against him, and it affected his social and emotional well-being. And it became very hard for my husband and I as parents to send our son to school, knowing that every day he would come home and through a communication log be written with everything that he was not able to do and everything that he did wrong, which was all a result of him having FASD. My husband and I took it upon ourselves to research FASD and to train the staff and anyone that worked with him. It took us years to get the staff on board to understand the FASD. And when we did, we were able to create a thriving environment for our son. To this day, I'm very grateful for those who have taken the time to learn about FASD. It has been a battle for us. I know that by passing this bill and creating a work task force, we will fill in that gap to mitigate the need that is needed for children who are undiagnosed, misdiagnosed, and who need the help correctly through providing FASD-informed approach services that are appropriate. I also know that these children will one day become adults and that it can change their pathways in life by providing them a more successful life. As we know, more than these children or individuals with FASD have a higher chance of ending up in the criminal justice system. That was told to me early on. If we know this, then we can redirect their paths.
I hate to cut you off. I appreciate your passionate testimony. I try to be consistent on the 2-minute limit so that we can make sure we get to a vote on all these bills. So we do have to move on. Is there anyone else on the call who'd like to testify?
Thank you.
Okay, I'd like to note for the record, Department of Budget and Finance with comments. The following individuals in support: Cleota Brown, Hawaii Substance Abuse Coalition, Office of the Public Defender, Gigi Davidson, Akiko Tamura, and Greg Jafchees. Members, any questions? Okay, we'll move to the last measure on the agenda, SB 2748, relating to individuals with disabilities. This requires the Department of Health to submit a request as allowed by federal code to the United States Department of Education to allow parents of children with a disability to continue receiving early intervention services after the child turns 3 years of age and until the child enters kindergarten. Department of Health.
Good afternoon. My name is Matthew Shim. I'm Chief of the Family Health Services Division. The department stands on its testimony providing comments, and I'm here to answer any questions. Thank you.
Thank you very much. Nikki Kipo'o in support.
Hi, aloha. Thank you, Chair and Vice Chair and committee members. I stand on my testimony. I also wanted to give some insight as a parent with a child with a disability. Almost all of our parents, we have children that enter the system and we receive great services from early intervention, but at 3 years old, it cuts off to the Department of Ed. We have maybe about a month or two of transition meetings before they're transitioned to the academic side, but the families lose all service the date of their 3rd birthday. So if one is not met for their educational plan, then the children are automatically without any services from either side until the parents agree to go into the DOE system. So I know that the federal government will provide an additional 18 months of funding to support this bill. I do want to encourage the board to understand that this is a problem that a lot of us families have, because from 0 to 3, we don't really understand any of the processes, and then we're just thrown into a new process without any support. So I really do ask that you read through this bill and also support it all the way through. Mahalo.
Thank you very much. We also have written testimony from the Disability Communication Access Board, Hawaii Association for Behavioral Analysis. In support, Hawaii Children's Action Network speaks with comments. And Linda Elento, please go ahead.
Hello, I'm Linda Elento. I am a parent, and I thank you for introducing this bill. And I would appreciate your continuing with passing this bill. There are gaps, meaning the children who do turn 3 We've done, there's lots of meetings that happen and lots of assessments and so forth. But what we need to focus on is the needs of our family. And we have programs. They're being looked at. The Early Learning Board just had a meeting, or they're meeting right now this afternoon. I was just surprised that it's still a way of discussing who should be on the board. That's one of the bills that's out right now. Instead of looking at the issue of there is no policy that says that our children can continue, but the IDA, the federal law, does allow for it. And there are other states, several more states, and the Department of Health has reported in their testimony. 3 in particular have submitting new policies this last year. The federal government has also given additional funding for the Part C option. But I wanted to sum up when we did research in the past, the cost of early intervention for one person compared to moving them into special ed was substantially more when they went to special ed. So it was cost effective, and you're able to include these children in home childcare and getting the developmental services that they need. So I appreciate your time, and I appreciate your further looking into these matters and the fact that we do need the legislature to be involved. This decision could have been made 18 years ago when Congress decided for everybody that it could be done. And military families need flexibility, and the mental health of our families are most important, in my opinion. Thank you so much. And I'm available for questions today and anytime after. Thank you.
Thank you very much. Members, any questions? Okay, seeing none, we've reached the end of the agenda. Chair, I'm prepared to vote.
Yes, we're ready for decision making. So for and I have provided all of my committee members with proposed VM notes. So first up on SB 2424, Chair's recommendation is to accept Department of Human Services amendment to delete proposed section 4 lines 11 through 17. Clarify that CWS would investigate all of those involved. Otherwise, to pass with amendments. Vice Chair, are you ready for the vote on SB 2424?
Yes.
We're going to pass with amendments. Chair votes aye.
Okay, for the committee, members of the Committee on Human Services, we're voting on the recommendation to pass Senate Bill 2424 with amendments. Chair Buenaventura.
Aye.
Vice Chair votes aye. Senator Ocasio.
Aye.
Senator Misalucha.
Aye.
Senator Favela is excused. The recommendation is adopted.
Health Committee, same recommendation. Chair votes aye.
Chair votes aye, Vice Chair votes aye. Senator Moriwaki is excused. Senator San Buenaventura. Senator Favela, excused. Chair, your recommendation is adopted.
Thank you.
So for SB 2880, Chair's recommendation is to pass as is. Vice Chair for the vote.
Any reservation or objections to the recommendation to pass Senate Bill 2880 unamended? Hearing none, I'll cast an aye vote for all members present.
Same recommendation for the Committee on Health, passed with amendments?
No,
Chair votes
As
aye.
is, sorry, as is. Chair, Vice Chair,
Chair votes aye.
Chair votes aye, I vote aye. Any of the other members that are on, any no votes or reservations? Senator San Bonaventura?
Aye.
Chair, your recommendation is adopted.
Thank
So
you.
for thank you. So for SB 2883 relating to medical facilities, Chair's recommendation is to blank out the appropriation language and and remove HHSC. We are going to accept the introducer's proposed amendments, which are on page 3, lines 1 through 12. Strike out the original composition of the task force and instead insert 1, the Chief Executive Officer of HHSC to serve as chair, 2, add in Director of Health or designee, 3, Director of Human Services or designee, 1 representative of the Queen's Health System, 1 representative from the Office of Language Access, 2 members of the Senate to be appointed by the Senate President, 2 members of the House of Representatives to be appointed by Speaker of the House, and add in a member of the Compact of Free Association Community Leaders. And that's it. Any comments, questions, and concerns?
What she said.
Okay.
Yes, you heard the chair's recommendation to pass Senate Bill 2883 with amendments. Any reservations or objections to the recommendation? With Senator Favela excused, the recommendation is adopted.
Okay, Health Committee, same recommendation, passing with amendments. Chair votes aye.
Chair votes aye. Vice Chair votes aye. Senator Moriwaki is excused. Senator San Buenaventura.
Aye.
Senator Favela is excused. Chair, your recommendation is adopted.
So for SB 2737, Chair's recommendation is to pass only with technical, non-substantive amendment for the purposes of clarity and consistency. Vice Chair for the vote.
Any objections or reservations for the recommendation to pass Senate Bill 2737 with amendments? Hearing none, the recommendation is adopted.
Health Committee, same recommendation.
The members
Chair votes
present, any nays or reservations? If not, 3 aye votes. Chair, your recommendation is adopted.
Thank you.
Thank you. For SB 2634, Chair's recommendation is to solely add a defect date because of the DNF's comments. Any comments, questions, concerns? Seeing none. Vice Chair for the
Any
vote.
reservations or objections to the chair's recommendation to pass Senate Bill 2634 with amendments? Hearing none, the recommendation is adopted.
Health Committee,
so-
same recommendation. Chair votes aye.
Chair votes aye. Vice Chair votes aye. Senator Moriwaki is excused. Senator Favela is excused. Senator San Buenaventura votes aye.
Yes.
Chair, your recommendation is adopted.
Thank you very much. Next measure, SB 2432. Recommendation is to pass this out with technical amendments, accept the Department of Health amendment, changing references to fine to administrative penalty, and amending the measure to exclude persons acting in their individual capacities. We're also going to defect the effective date to January 1, 2050. Any discussion?
No.
Seeing none. Vice Chair, SB 2432 passing with amendments. Chair votes aye.
Vice Chair votes aye. Senator Moriwaki is excused. Senator San Buenaventura.
Aye.
Senator Favela is excused. Chair, your recommendation is adopted.
Same recommendation for Human Services. Chair votes aye.
Any reservations or objections to the recommendation to pass Senate Bill 2432 with amendments? Recommendation is adopted.
Thank you very much. Next measure, SB 2200. The recommendation is to pass this measure with a defected effective date of January 1, 2050. Any discussion? Seeing none. Vice Chair, SB 2200 passing with amendments. Chair votes aye.
Vice Chair votes aye. Senator Moriwaki is excused. Senator San Buenaventura.
Aye.
Senator Favela is excused. Chair, your recommendation is adopted.
Same recommendation for Human Services. Chair votes aye.
Any reservations, objections to the recommendation to pass Senate Bill 2200 with amendments? Hearing none, the recommendation is adopted.
Thank you very much. Next measure, SB 2647. The recommendation is to remove the special fund from the bill and add a blank appropriation to allow the Department of Health to facilitate the group. Also defect the effective date, and we have some technical amendments. Any discussion? Okay, seeing none. Vice Chair, SB 2647 passing with amendments. Chair votes aye.
Vice Chair votes aye. Senator Moriwaki is excused. Senator San Buenaventura.
Aye.
Senator Favela is excused. Chair, your recommendation is adopted.
Thank you.
Same recommendation.
Same recommendation, I'm sorry, same recommendation for Human Services.
For Human Service members present, any reservation objections to the recommendation to pass Senate Bill 2647 with amendments? The recommendation is adopted.
Thank you very much. Last measure on the agenda, SB 2748. The recommendation is to convert this bill into a session law instead of amending the HRS. We'll also attach a blank appropriation to the bill and defect the effective date to January 1, 2050. Any discussion? Seeing none, Vice Chair, SB 2748 passing with amendments. Chair votes aye.
Vice Chair votes aye. Senator Moriwaki is excused. Senator San Buenaventura.
Aye.
Senator Favela is excused. Chair, your recommendation is adopted.
Same recommendation for Human Services.
Any reservation objections to the recommendation to pass Senate Bill 2748 with amendments? Hearing none, recommendation is adopted.
Okay, so we're moving on to the 345 calendar. You can adjourn for health. Thank you, thank you.
Mahalo.
Thank you. So for, okay, gaveling out on the joint hearing, gaveling in for the 3:45 calendar. Thank you. For SB 3109 relating to reports to the legislator for the Department of Human Services. First up, we have Human Services, State of Hawaii in support. Anything more to add to your written testimony, Director Betts?
No, Chair, we stand in support of this administration measure. Thank you.
Thank you very much. Okay, any questions of Director Betts on SB 3109? Okay, seeing none, we're moving on to SB 3110. Relating to child care grant programs, the Department of Human Services renames the preschool grant program special fund to child care grant program special fund. Authorize the child care grant program special fund to be used to give grants to child care facilities, adds federal funds as one of the fund sources for the child care grant program special fund. Changes the legislative report due date for the preschool open door special fund and child care grant program special fund from August 31 to 20 days prior to the start of the next legislative session, and deletes the authority to expend without an appropriation for the preschool open doors special fund and child care grant program special fund statutes to conform to the Hawaii State Constitution. First up is Director Betts in support. Anything to add on your written testimony?
Thank you, Chair. Nothing to add. Thank you very much.
Okay, thank you very much. I also in support written testimonies from Executive Office on Early Learning, Early Childhood Action Strategy, all in support. Questions, members? Okay, seeing none, we're going to move on. SB 3111, relating to Family Resource Center. We are, sorry, 3111. Establishes the Family Resource Center's pilot program, establishes one full-time employee for the Family Resource Center's coordinator position and appropriates funds. First up is Hawaii State Department of Education in support. Anything to add from your written testimony? Well, there's no one there. So we're going to move on. Director of Human Service, I see Director Betts. Anything to add to your written testimony?
Thank you, Chair. Nothing to add. We stand in strong support of this measure. Thank you.
Thank you very much. Department of Health in support. Okay, State Procurement Office providing comments. No one else registered to vote, registered to testify on SB 3111. We have Department of Health in support, Department of Education in support, Department of Budget and Finance providing comments, Neighborhood Place of Kona providing support, 3111. Blueprint for Change in support, Hawaii Children's Action Network speaks in support, Kailua High School in support, Ohana Support Network in support, Hawaii After School Alliance in support, Noel Richardson in support, and Gerald Silva in opposition. Members, any questions of Director Betts? Only person here. Okay. Excuse me. Seeing none, we're moving on. SB 3112, relating to background checks, authorizes state and national criminal history checks for current and prospective employees, volunteers, and contractors, and their employees, agents, and volunteers who are in positions that require close proximity to children, young adults, or vulnerable adults receiving child welfare services, social services, or certain other benefits and services from the department, makes non-substantial conforming amendments to section 345-2.5 and 846-2.7. So for 3112, we only have the Department of Human Services and support. Director Betts, anything to add on your written testimony?
Chair, nothing to add. We'll stand on our written testimony in strong support. Thank you.
Members, any questions of Director Betts? Okay, seeing none. Moving on to SB 3113, which is relating to Kupuna Care Program, incorporates the Kupuna Caregivers Program into the Kupuna Care Program and adds services for care recipients, caregivers, and employed caregivers. It's our last measure for the day, and that would be Office of Aging, Department of Health and Support.
Yes, Senator, thank you so much for hearing this measure. And yes, we stand on our written testimony and support and here to answer any questions you may have. Thank you.
Okay, thank you very much. No one else having registered to testify. Members, anyone online wishing to testify on SB 3113? Seeing none. Those in favor providing written testimony, Hawaii County Office of Aging and Support. Maui County Office of Aging and Support, Zonta Club of Hilo and Support, AARP and Support, Alzheimer's Association of Hawaii and Support, AAUW of Hawaii and Support, and John Tomoso, individual in support. Anybody else wishing to testify online on SB 3113? Members, any questions? Seeing none. Okay. We have time, so let's go out in the breakout room. For decision making, the 345 calendar for the the Committee on Human Services. For SB 3109, Chair's recommendation is to pass it as is. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
We're voting on the chair's recommendation to pass Senate Bill 3109 unamended. Chair San Buenaventura.
Aye.
Vice Chair votes aye. Senator Ocasio.
Aye.
Senator Misalucha.
Aye.
Senator Favela.
Aye.
Recommendation is adopted.
So for SB 3110, Chair's recommendation is to pass this with technical non-substantive amendments for the purpose of clarity and consistency. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Any reservations or objections to the recommendation to pass Senate Bill 3110 with amendments? Hearing none, recommendation is adopted.
Okay, voting on SB 3111 relating to family resource centers. Chair's recommendation is to basically just add a defect date because of budget and finances concerns. Otherwise, add in technical non-substantive amendments for the purposes of clarity and consistency. Any comments, questions, concerns, folks? Seeing none. Vice Chair for the
Any
vote.
reservations or objections to the recommendation to pass Senate Bill 3111 with amendments? Hearing none, recommendation is adopted.
Okay, so for SB 3112, Chair's recommendation is to just add a defect date, add in technical non-substantive amendments, accept SMA's recommendation of replacing foster boarding homes with resource family homes. And any references to foster family to be resource caregivers as required by a prior statute. Any comments, questions, concerns? Seeing none? Okay, please.
We're voting on the chair's recommendation to pass Senate Bill 3112 with amendments. Any reservations or objections to the recommendation? The recommendation is adopted.
Okay, thank you. For SB 3113, we're going to pass this with technical amendment for the purpose of clarity and consistency. We're going to remove parts of definition of section 1 that are not being added, amended, or repealed per SMA's recommendations. Any comments, questions, concerns?
Not. Shall we vote?
Yes, please.
Any reservation objections to the recommendation to pass Senate Bill 3113 with amendments? Hearing none, the recommendation is adopted.
Okay, well, thank you very much. We're gonna say goodbye now pretty soon to the Kapuna Caregiver Program. In lieu of the Kapuna Care Program, and we just hope that the Department of Office of Aging will take into concern what create the Kapuna Caregiver Program to begin with, and we'll put that into the committee report. And thank you, members. We are adjourned.